I don't usually deep dive into the story of a drug, but I felt that it could be good to do it for Ozempic given the hype around it. And buckle up because it spans like 100 years. What is Ozempic? How was it brought to market? And what it is tested for? Ozempic is a hot topic right now because people are using it to lose weight, but it has been used as a treatment for type 2 diabetes since 2017, I think, and it comes from over 100 years of research. Let me tell you the story. 1920, we discovered that in type 1 diabetes, some cell clusters in the pancreas are destroyed. Those are the cells that produce insulin, but we don't know that yet. 1921, this molecule, it was insulin but it wasn't called that yet, was isolated from dogs and successfully used to treat diabetic dogs that had their pancreas removed. Bleh. 1922, insulin was used for the first time in human in a young boy with type 1 diabetes and quite literally saved his life. The name insulin was used for the first time that year at a medical conference. Early 1923, the team sold the patent for insulin to the University of Toronto for $1 so that everyone could make it. Late 1923. Insulin is mass-produced, Nobel Prize. Since this discovery, 100 years ago, scientists all over the world have been trying to find a molecule that increases insulin in the blood to treat type 2 diabetes. But with no tool to measure insulin concentration in the blood, that was really hard. Until the 50s when someone finally managed to measure insulin. And we got a first hit in 1968. That protein was called something really ugly like gastric inhibitory peptide, then changed to glucose-dependent insulinotropic polypeptide, which is even uglier, or GIP. But it didn't keep its promises. It didn't work in people with type 2 diabetes. So back to the labs. In 1986, so 65 years after the discovery of insulin, we got another hit. That was glucagon-like peptide 1, or GLP-1, the very molecule that Ozempic mimics. Fun fact, at the time, not so fun, but anyways, when it was discovered, it was not like, wow, we found something great. No, people were still in the hangover of the disappointment of GIP, and they didn't really believe this one was going to be any different. But it was different. This one worked. And not only was it found to increase insulin levels, but to also decrease glucagon levels, the hormone that makes the liver release glucose in the blood. It was also found to inhibit gastrointestinal secretions and motility, which makes the body absorb nutrients slower and slows down glucose release into the blood. It also makes people eat less. And all of that without causing hypoglycemia because it stops working when the glucose levels in the blood drop too much. The only issue was that GLP-1, the original hormone, was degraded super fast in a matter of minutes, and it didn't last long enough in the blood. So either we found a way to make it stay active in the blood longer, or a way to infuse it 24/7 with subcutaneous devices. Blech. Obviously, the first option was more acceptable, and so people started working on ways to prevent GLP-1 degradation. The enzyme responsible for degradation was identified, its inhibition was validated for treatment of pigs in 1995, and proved to be usable in humans in 2005 by this small clinical trial, and many others in the following years. This drug is now used under the name vildagliptin. But we didn't stop there. In the search of a GLP-1 mimic that does not get bullied by the enzyme that degrades it, a team isolated the protein from a very unexpected place, the saliva of this little guy, in 1992, and called it exendin 4. And it works just like GLP-1, but it stays active for up to 5 hours, which is enough to be useful. It was validated in 2005 by clinical trials and is on the market since under the name exenatide or lixisenatide. And we're getting closer and closer to Ozempic at this point. In 2010, another one was approved for diabetes called Liraglutide with a half-life of 12 hours. In 2014, Liraglutide was also approved for weight loss. Pushing for longer half-lives, people made GLP-1 mimics that require only one injection per week. Those are albiglutide, liraglutide, and semaglutide, which is Ozempic. But although they are good at controlling glycemia, they are more expensive than metformin and others, and that's why they are used as a second intention treatment for type 1 diabetes. She meant to say type 2. Semaglutide, Ozempic, was approved for use in type 2 diabetes in 2017 under the name you know, and for weight management in 2021 under the name Wegovy. Can you imagine being a researcher and working in a field knowing that humanity has been working on the same problem for 100 years? Diabetes and obesity are only two of the potential uses of GLP-1 receptor agonists, the family that Ozempic belongs to, and because they have an impact on brain functioning too, they are currently being tested for Parkinson's disease, Alzheimer's disease, alcohol abuse, addiction to cocaine, nicotine, bipolar disorder, depression, schizophrenia, but also osteoporosis and polycystic ovarian syndrome. If you're interested in diabetes, I also have other videos about what causes type 1 diabetes, for example, you can check them out. And if you want something specific, just let me know in the comments.